There's really no feeling quite like it, is there? That sudden, gut-wrenching panic when you realize your dog isn't just a little off, they're really sick. Your mind just starts racing, and it's so easy to feel completely helpless.
So, picture this, it's the middle of the night, of course, your regular vet is closed, and you're staring at your dog faced with this huge decision. Do you wait it out until morning, or is this a real emergency? That uncertainty, it can be absolutely paralyzing.
But what if you could trade that panic for a plan? That's exactly what we're going to do here. We're going to give you a clear, step-by-step framework so you can assess your dog and make a confident decision when every single second feels like it counts.
Okay, so the very first step is to become your dog's first responder. And don't worry, you don't need a veterinarian degree for this. You just need to know how to perform a few quick checks that will give you a ton of critical information about their overall stability.
We're going to focus on 3 really simple, non-invasive checks. Think of these as the foundation of your at-home triage. They're going to tell you so much about what's going on with your dog's basic systems.
All right, first up, hydration. All you do is gently pinch a little bit of skin between your dog's shoulder blades, and then just let it go. If it snaps right back, that's great. They're likely well hydrated. But if it stays up in a little tent or kind of slowly slides back down, that's a big red flag for dehydration, and that is a serious concern.
Next, you're going to gently lift your dog's lip and take a good look at their gums. What we want to see is a nice bubblegum pink color, and they should feel moist. Now, the worry signs are really telling. Pale or white gums can mean shock or anemia. Blue or purple, that's a serious lack of oxygen. And if their gums just feel sticky or tacky, that's another big confirmation of dehydration. For the last check, just gently feel their belly. It should feel soft and relaxed, kind of like a pillow. The crucial thing you're looking for here is any hardness or bloating. And I cannot stress this enough, if their belly feels tight and swollen like a drum, especially if they're trying to vomit but nothing's coming out, that is a life-threatening emergency called bloat. You need to get to an ER immediately.
Okay, so with that initial assessment done, let's play detective. It's time to start decoding their specific symptoms. You got to think of these as vital clues that your dog is giving you about what's actually wrong on the inside.
A sudden loss of appetite is one of the biggest ways a dog communicates with us. You know, it's not just them being picky. A dog that turns down food, especially their favorite treats, is often screaming, "I feel nauseous," or "I'm in pain." It's one of the most reliable first signs that their body is busy fighting something off.
Now let's talk about vomit. I know it's gross, but what it looks like can tell you a whole lot. A little yellow liquid? That's probably just bile from an empty stomach. No big deal. But as you can see, the urgency really ramps up from there. Pink streaks? That's fresh blood, and that means you need to call the vet. But this is where you really have to pay attention. If it looks like dark coffee grounds, that's digested blood, a sign of internal bleeding, and anything bright blue could mean they got into poison. Both of those are absolute drop-everything emergencies.
You know, pain isn't always obvious. Dogs are absolute masters at hiding it. So you have to look for these little behavioral shifts. Are they cawing at their mouth? Suddenly only wanting soft food? That could point to a painful dental problem. Hiding away, being grumpy, not wanting to play? These are all their ways of quietly saying, "Hey, I really don't feel good."
Okay, you've done your physical checks, you've decoded the symptoms, you've gathered all your clues. Now comes the moment of truth, making the call. This part is all about giving you a clear, evidence-based way to decide your next move.
You know that old advice? Just wait 24 hours? Well, modern veterinary medicine has kind of moved on from that. Instead, a lot of vets now use a really simple, memorable tool to help guide owners. It's called the 3-strike rule. So how does it work? It's actually pretty simple. You can probably just monitor your dog at home if they've only vomited once and they're still acting totally bright and normal. But you need to call the vet immediately if strike 3 happens, meaning they vomited 3 or more times in one day. You also need to call if it's forceful, shooting across the room, or if it's combined with other things like lethargy. And remember, the rules are always stricter for puppies and senior dogs. They just don't have the same reserves.
So let's say you decide to go to the emergency vet. First of all, you made the right call. But knowing what to expect when you walk through those doors can really help lower your own anxiety. Here's a little peek at what the pros are going to do first.
The moment you arrive, the vet team is going to jump into action with what's called a primary survey. And what's cool is you can think of it as a rapid-fire expert version of the assessment you just learned at home. It's focused on the 3 most critical body systems, and they call it the ABCs of triage.
A is for airway. First and foremost, always. They're going to make absolutely sure that nothing is blocking your dog's throat and that they have a clear path to get oxygen into their lungs. This is priority number 1 in any emergency, period.
Next up, B is for breathing. Just because the airway is clear doesn't mean the dog is breathing well. The team will immediately assess the rate and the effort of their breathing to see if they need help, like getting some supplemental oxygen.
And finally, C is for circulation. This is all about the heart and blood flow. They're checking for a heartbeat, feeling the quality of the pulse, and assessing blood pressure. What they're really looking for here are any signs of shock, which is when there's not enough blood flow getting to the organs.
Phew, okay, we have covered a lot of ground, so let's just boil it all down to the absolute bottom line. These are the non-negotiable red flags that mean you stop everything you're doing and get to a vet right away.
This right here is your ultimate takeaway. If you see vomit that looks like coffee grounds, a hard, bloated belly with that unproductive retching, or pale, white, or blue gums, it's an emergency. Go. The same goes for any trouble breathing, a seizure, or if you even think they ate poison. And finally, and this one is so key, if your dog has 2 or more serious symptoms happening at once, like vomiting and being super lethargic, the whole situation becomes way more urgent.
In a crisis, you are your dog's most important advocate. You are their first line of defense. And having a plan like this transforms that raw fear into focused, effective action. So the real question is, are you prepared to be their first responder?